HCPS is committed to safety and health during normal times and during the COVID-19 pandemic. It is important to review some of the basic and most critical components of COVID-19 safety protocols as we welcome more of our students and staff back into the school building. Right now, HCPS school buildings have limited access that is primarily focused on learning for students. Visitor appointments will still be required, and schools will still not be holding special events, assemblies, or offering in-person extracurricular activities. No person positive with COVID-19 with symptoms or who has been exposed to a person with COVID-19 in the past 14 days may visit HCPS. In planning for the daily use of HCPS school buildings, staff have to utilize widespread guidance related to COVID-19 safety and health from several agencies, including the Centers for Disease Control and Prevention, the Maryland Department of Health, the Maryland State Department of Education, the Harford County Health Department, and Harford County Public Schools Board Policies and System Procedures. COVID-19 safety practices start at home each day, whereby families are expected to monitor all students attending class in person for signs and symptoms of COVID-19. Families will receive a COVID-19 parent acknowledgement letter outlining expectations with daily home screening rules and communication required if a student receives a positive COVID-19 diagnosis or has been exposed to a person confirmed to have COVID-19. Students may not board a school bus or come to school if they have a fever of 100 degrees or greater, or if they have any symptoms of illness. Families are expected to consider a student's personal health risks and to independently evaluate attendance in person during the COVID-19 pandemic. COVID-19 is a respiratory illness, and all the guidelines we've been given indicate that wearing a mask is one of the most important lines of defense we have against the virus. Respiratory droplets are from the mouth and nose, so face coverings must completely cover both. Parents should ensure chosen face coverings have a good fit that ensures both the mouth and nose are covered consistently. Parents should provide fabric face coverings for their own student and should provide a sufficient supply of clean face coverings to allow replacing the covering as needed. Parents should be sure the face coverings are clearly marked with the child's name and that it is clearly marked or designed to distinguish which side of the covering should be worn facing outwards. During the day, masks may be removed by the student for meals and outdoor play when social distancing can be maintained, or when it needs to be replaced. Nursing staff and staff attending to students with special needs will utilize appropriate personal protective equipment for their unique circumstances. HCPS is committed to the guideline of 6 feet social distancing. Until the guidance of the 6 feet rule is lessened, our school buildings will continue to function only with small student groups at a time. In all decision-making, we first ascertain how 6 feet can be maintained for the activity and then plan from there. It is important to specify that COVID-19 protocols require both masks and social distancing, not one or the other. Regular hand washing is one of the best ways to remove germs, avoid getting sick, and prevent the spread of germs to others. Practice hand washing at home to feel confident in your students' hand washing practices. Washing hands with soap and water for 20 seconds is the best way to get rid of germs in most situations. Students will be expected to wash hands when entering school buildings before eating lunch for bathroom use and periodically throughout the day. Alcohol-based hand sanitizer can and will be used in the school building as well. Please send a water bottle to school with your student. Water fountains will be accessible for filling water bottles, but during COVID-19, water fountains can't be used in the traditional manner of placing a mouth near a water fountain spout. The health and safety of your student is important, which also includes staying hydrated, so be sure to mark your student's name on the bottle and send one every day. This screen provides just a snapshot of the diligent and thorough cleaning protocols that will be employed by HCPS custodial services and staff every day at our schools. High-touch surfaces such as door handles and sinks will be disinfected as often as possible during the day, and extra spray bottles and disinfectant will be distributed throughout each building to assist in this task. Special cleaning will be conducted where any individual with symptoms of COVID-19 visited in a day. Wherever possible, there will be no shared materials that require sanitization, but staff will be mindful of any surfaces or equipment that requires cleaning between use. Our school nurses play a critical role in the school building by providing clinical care and responding if a person becomes ill at school. Nurses will adhere to the latest Maryland Department of Health guidance regarding isolation, quarantine, and communication. Nurses will partner with the Harford County Health Department to identify close contacts of anyone with suspected COVID-19. A close contact is someone who was within 6 feet of an infected person for at least 15 minutes, starting from 2 days before the illness began. The school nurse will review a clinical decision tree created by the Maryland Department of Health and determine if a group of students need to be sent home until a quarantine period of 14 days ends, an alternative diagnosis with documentation is given, or until a negative COVID test is received by the ill person. Please understand that this means your student may be sent home if it is determined that they had close contact with an individual with COVID-19 symptoms. Families should think about a plan for how their student might be picked up during the school day, or what a quarantine period may mean for childcare. Please note that students with COVID-19 symptoms or quarantined will not be allowed to return home on an HCPS school bus. Our transportation services will be working with reduced capacity on each school bus. One rider will be allowed per seat, although siblings will be able to sit together. Fabric face coverings or masks will be required on the bus, and students with COVID-19 symptoms must never board a school bus. Sanitization of bus seats will occur between routes, and HCPS will work with all bus contractors to ensure safety and health continues to be a priority. HCPS requires independent child care providers to provide their own COVID-19 safety protocols and comply with the Maryland Child Care Guidance for COVID-19. For child care providers at our schools, this will include maintaining masking and social distancing, keeping small groupings and cohorts, ensuring hand washing and sanitization, and having robust plans for illness response and communication. Please help the success of our school system by working with your student on appropriate mask wearing, hand washing, and social distancing. Provide daily health screenings before your student boards a bus or enters a school building. And always keep your student at home if they have symptoms of any illness. Please check with your personal health care provider with any COVID-19 questions or concerns. As we continue our COVID-19 recovery efforts, we don't know exactly what the future holds for this pandemic. We do know that whatever learning looks like, whether virtual or in person, together we are moving forward.